This is me, Gayatri Prakash, and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about how to write a letter to a psychologist. Because most of my students has asked me like how to write a letter to a psychologist, like what kind of the information we have to pick it from our case note, and either we have to mention medical history as well when we are writing a letter to a psychologist. So here I have few points that when you are writing a letter to a psychologist, what are the points that we need to, what are the information that we need to pick it from our case note. So here I would like to discuss with you all. Okay. So psychologist is the person who is treating a patient related with a mental illness, not a medical illness. So here itself our answer. When you have receiving a case note about a particular patient, for example, patient admitted in the hospital because of the knee injury or compartment syndrome or any kind of disorder, and patient has undergone a surgery or patient has undergone like an amputation or a major surgery. So post-operatively patient was not feeling well and patient has low confidence level, maybe after the amputation, after the major surgery, so how he can go back to his normal life. So that this all are the thinking of the patient will may cause stress, depression, sometimes mood swings. So we are writing a letter to a psychologist from the hospital to psychologist, like we are referring a patient who is under our care and finished a surgery and is in on post-operative period, but patient suffers with the mental illness such as depression, stress and mood swings, refusing of taking the tablets, not cooperating with any of the treatments. So thereby we are just referring a patient to a psychologist to provide proper counseling session, to do a mental assessment or psychological assessment, to find out what is exactly the patient has suffers with. So like that we are just writing a letter. So here especially what information that we need to pick it from the case notes, which means when you are writing an introduction, it's better to write the patient that suffers with any kind of the depression or any of the things following a surgery, like that. For example, Mr. X has been suffering with the depression, or Mr. X who has depression following an amputation, full stop. He requires your psychological assessment. And counseling. Like that we can write it. So here rather than writing a medical condition, better to write a symptoms, or better to write what the patient is experiencing psychologically. That can be written in our introduction. That will be the appropriate introduction for the psychologist. So when you are coming to the present medical history paragraph, so what we can write in present medical history paragraph, which means in the present medical history paragraph it's better to write like patient was admitted on so and so date and had amputation on so and so date. Post-operatively patient started to develop depression, which includes refusing taking of the medications, mood swings, patients sometimes crying and laughing and sometimes looking so sad. And also we can write it, patient refused to attend a post physiotherapy session and refused to use the artificial legs or something like that, we can use it. So these all are the information. Rather than writing patient receiving analgesics, antibiotics, patient patient was in ICU for 3 days and patient transferred to the hospital, transferred to the normal ward after the 3rd day, and the patient wound dressing is healing well. So instead of writing that all those things, because better not to write a medical related condition. So because of the medical related condition, what patient is experiencing psychologically, because here we are writing a letter to a psychologist who is treating a patient for the mental illness, not the medical illness. So here we have to understand very clearly while you are picking the information when you are writing to a psychologist. And then so these all the information can be written. So patient is refusing taking medication, patient is depressed, patient is showing some mood swings, crying, laughing and sad, and patient is refused to participate in any of the physical activities due to his depression. So patient is talking about negative things like, for example, I'm going to die and I won't lead a normal life like other people. I living in this world is waste. So like kind of a negative thoughts, all the information has to be mentioned in our present medical history paragraph, which is related to the surgery means. And coming to the social background, so in the social background mainly we have to mention about Is the patient having any significant family history of any psychological illness, for example, psychiatric illness, for example, depression, manic disorder, schizophrenia, and any mood disorders, like that, anything is there that we have to mention it surely. And second thing is, patient has any old history of depression, patient was on any treatment, patient has taken any ECT, like convulsive therapy, something like that, our patient is on any tablet for the depressions, sertraline, so that's kind of tablets, if the patient is taking any medications for that. So that all those things must be mentioned. Also, if the patient suffer with any kind of seizure, so that also is important to mention about it in the social background history. And coming to the recommendation paragraph, so recommendation paragraph, don't write about the medication thing, and don't write about the physiotherapy sessions, don't write about appointment sessions, just write about the psychologist, what the psychologist can do for the patient. For example, he can provide counseling, he can do the full psychological assessment with the involvement of the case manager, or he can just do the therapy session, ECT, or kind of a therapy session, or he can prescribe the medication which is related to his psychiatric conditions. So only these information we have to look from the case note, rather than writing dressings and wound healing process and physiotherapy sessions, medication. So this is not important. And also, don't write about that patient is having hypertension for these many years, taking these many tablets, and diabetes for these many years, heart disease for these many years, because it's all informations are irrelevant. Only one concept that we have to make sure is, psychologist is a person who is treating the patient's mental illness, not a medical illness. So just think about it. If your patient is having any eating disorder, bulimia nervosa, anorexia nervosa, so these are all psychiatric related issues, so that this all can be treated by a psychologist. So these can be written in our social background or present medical history paragraph. So only one thing is, like, psychologist is a person who can treat the patient's mental illness or eating disorders, but not a medical related issues. For example, cardiac problem, fracture, or any of the underlying conditions like heart disease or kidney disease or liver disease or diabetes, hypertension. So he can't do anything with that, because he is not specialized for that. He is the person who is specialized to treat the mental illness. So only mental related issues, mood swings, depression, stress, and also you can just write about manic episodes, and also negative thoughts, suicidal attempts, and then family history of psychiatric illness, patient is taking any medications for the psychiatric illness, and these kind of the eating disorders, these kind of information can be written in our letter when you are writing a letter to a psychologist. So pick the information wisely, what the person to whom we are referring our patient, what that person can do to our patient as per their conditions. Okay, I hope this video might help you all to know how to write a letter to a psychologist. And whomever wants to join in our class, our number has given in our description. We have 20 days class, 30 days class, 40 days, 50 days, 60 days classes also is there. And also separately writing and speaking classes also is going on. And the beginners classes also is going on. So whomever wants to join in our class, you can contact us at any time. Our number has given in our description. Okay, so until then, bye-bye.